Welcome. My name is Brenda Scott, and I am a commissioner with the Riverside County Behavioral Health Commission. The Behavioral Health Commission is an advisory body composed of volunteers appointed by the Board of Supervisors who work in conjunction with the Riverside University Health System Behavioral Health to ensure citizen and professional involvement in all aspects of department services. This video is designed to seek your input as a stakeholder in behavioral health care in Riverside County. Every year, California counties develop planning documents that identify mental health programs and services to be funded by the Mental Health Services Act, also known as MHSA or MISA, a voter-approved proposition from 2004. That proposition was written to include meaningful participation from the community. We encourage everyone to provide input. This video includes speakers who will give you an overview of Mental Health Services Act, highlights from the Riverside County Plan, and program goals developed out of stakeholder input just like yours. When this video is posted, it will include a link to the entire draft plan and to a toolkit of plan summary materials. You will also find a feedback form that can be completed and submitted electronically. For those wishing to provide verbal comments instead, this post also includes an MHSA feedback telephone voicemail number that allows you to leave recorded feedback. The Behavioral Health Commission will ensure that all stakeholders have an opportunity to be heard and all comments provided electronically or as a voicemail message will be recorded and become a part of the public record. The Behavioral Health Commission will review all the comments and recommend changes to the draft plan, if necessary, based on the comments received. Thank you for joining us today. Together we can improve opportunities for a healthier, more resilient Riverside County. Please share this video with anyone you know who cares about mental health programs in Riverside County. Each of the following speakers will introduce themselves before they provide you with their overview. Be well, stay safe.
Thank you, Brenda. My name is David Scholin. I'm a clinical therapist and the Mental Health Services Act Administrator for Riverside County. My job is to ensure Riverside's compliance with the Mental Health Services Act, otherwise known as MHSA or MISA. The Mental Health Services Act was a ballot measure passed by California voters in November 2004 that provided specific funding for public mental health services. The act imposed a 1% taxation on personal income exceeding $1 million, creating a dedicated funding stream for the public mental health service system across the state of California. Each county receives an allotted amount of funds, and each county develops its own MHSA plan. If you have an interest in the public behavioral health care system in Riverside County, you are a Riverside County stakeholder. An important part of MHSA compliance is ensuring an active stakeholder process where you and people like you can provide feedback on sustaining programs, developing programs, or changing programs in Riverside's MHSA plan. There are two kinds of MHSA plans: a 3-year plan, which includes goals over a 3-year period, and an annual update, which serves as a progress report on the 3-year plan goals. This video will serve as an introduction and orientation to the MHSA plan. This year's plan is an annual update. After you listen to this video, you can click on the links embedded with the post and read about the plan in more detail and how to provide written feedback. Or you can give verbal feedback by calling the MHSA feedback voicemail using the phone number also posted with this video. Or attend a regional in-person public hearing being held during this same time. Times and locations have also been added to this video. MHSA is only one of the funding streams for Riverside University Health System Behavioral Health, or RUHSBH. The MISA plan does not represent all of the public behavioral health services in Riverside County, and it is not meant to function as a guide to all services that are available. Not all services can be funded under the MHSA. MISA is divided into 5 components, almost like chapters in a book. Each component addresses a different area of the public mental health service system, and each has its own rules and regulations. As we introduce each component to you, we will also give you some related plan highlights. First up is the Community Services and Supports component, or CSS for short. Community Services and Supports, or CSS for short, is the largest of the MHASN components, and it represents 76% of the allotted MISA funds. It is designed to meet the behavioral health needs for each age group, from kids to older adults, and pays for positions and contracted services so the department can serve more people. CSS adds peer support services throughout our service delivery system. Peer support specialists are specially trained employees who either carry their own mental health diagnosis or are the parents of a minor child who has been in the behavioral health care service system, or are a family member of an adult who has had a mental health challenge. CSS also establishes a high-intensity therapeutic case management program called Full Service Partnerships, or FSP. FSP are designed to address the needs of people who have had the greatest consequences due to untreated mental illnesses, such as school failure, unemployment, incarceration, repeated hospitalizations, or homelessness. Over 50% of CSS funds must go to FSP programs. The CSS component also includes our housing developments and homeless outreach programs, our regional mental health 24/7 urgent care centers, our mobile crisis response teams, law enforcement and clinical therapist response teams, and the collaborative courts, which combine the authority of a court with a behavioral health treatment plan. Some CSS plan highlights in Riverside County's current plan are: the mobile crisis response for behavioral health is now available 24/7. The mobile crisis response teams include teams of clinical therapists, case managers, addiction counselors, and peer support specialists. These teams are dispatched to people in behavioral health crisis with the goal to de-escalate the situation, avoid unnecessary emergency department care, or psychiatric hospitalizations, or law enforcement involvement. After the de-escalation, the mobile crisis teams are able to connect the person to ongoing care. The mobile crisis teams are countywide and have successfully diverted 70% of contacts from law enforcement or acute inpatient admissions, demonstrating their effectiveness in handling crises without traditional enforcement methods. The crisis teams can be accessed by calling 951-686-HELP or 686-HELP. RUH-SBH has partnered with the Riverside Sheriff's Office 911 dispatch to add 2 clinical therapists to the dispatch center in order to assist with the immediate diversion of calls that can be addressed by the mobile crisis teams instead of by law enforcement. Another Riverside County crisis response collaboration is the Community Behavioral Health Assessment Teams, or CBAT for short. CBAT are police officer and RUH-SBH clinical therapist partnership teams that respond to the community to behavioral health-related calls that are dispatched by law enforcement. These teams bring together the safety and authority of law enforcement with the clinical and engagement expertise of behavioral health experts. Based on stakeholder feedback, the number of CBAT continue to expand. Current CBAT are located in the cities of Menifee, Corona, Beaumont, Cathedral City, Palm Desert, Hemet, Jurupa, Paris, Thermal, Lake Elsinore, Riverside, Moreno Valley, Indio, Temecula, and Murrieta. To prevent recidivism and assist with personal behavioral health recovery, our forensic services will launch Justice Enhanced Care Management, also known as ECM teams, in 2024. ECM services mean consumer access to a single lead case manager who provides comprehensive care management and coordinates all of the consumer's health-related care and services. These teams will provide ECM services to adults and juveniles while in jail or juvenile detention facilities, and will continue to provide ECM services to these same consumers after their release. A new access point for behavioral health services is called Community assistance, recovery, and empowerment, or CARE, more commonly known as the CARE Court. CARE Court launched in October of 2023. This new collaborative court team provides engagement, assessment, care planning, linkage, and wraparound case management services to consumers with schizophrenia spectrum disorders who are court-ordered to engage in supportive treatment. This new program complements existing similar collaborative court programs like assisted outpatient treatment. Now, to tell you more about the next MISA component is Diana Gutierrez, the Manager of Prevention and Early Intervention.
Hi, my name's Diana Gutierrez. I'm the Prevention and Early Intervention Manager with Riverside University Health System's Behavioral Health. The intent of prevention and early intervention is to engage people before the development of serious behavioral health need. Riverside's PEI plan has 7 plans or concentrated areas of need. Each work plan has several programs and services. RUHS primarily relies on community contractors to provide PEI services. Overall, PEI providers continue to show success in meeting program goals and objectives and reaching the target populations. PEI is largely outreach-based. Providers are typically in the community. PEI services are person-to-person services, but some virtual options are available when appropriate and preferred by participants. This year's update includes just a few highlights from the overall PEI plan. Please see the PEI component chapter in the full MHSA draft plan for more details and program information. PEI work plan is mental health outreach, awareness, and stigma reduction, which includes several different strategies that focus on mental health stigma reduction, education about mental health symptoms, and increasing access for underserved communities. The underserved communities in Riverside County are Latinx, African American, Asian Pacific Islander, Native American, LGBTQ+, deaf and hard of hearing, Middle Eastern, North African or MENA, spirituality, veterans, and people with disabilities. As part of the planning strategy to reach those underserved communities, PEI also funds some activities under our Cultural Competency Unit. Now we'll hear from the Cultural Competency Program for more information.
The Cultural Competency Program works to develop and continuously improve the cultural and linguistic service delivery of RUHS behavioral health. Its goal is to ensure the department provides equitable behavioral health care for all the individuals within the diverse community of Riverside County. While healthcare inequities exist, the Cultural Competency Program builds trust and connects our underserved, underrepresented, and inappropriately served populations to services by removing barriers to access. During the last fiscal year, we continued improving our service delivery infrastructure and goals as defined in the California State Required Cultural Competency Plan. Our cultural community liaisons, now established in their roles, work hard to identify activities to reduce disparities in accessing mental health services. It would take a long time to mention every accomplishment. These are some of the highlights of the achievements. In September 22, the Asian Pacific Islander, Desi American, and Native Hawaiian Subcommittee, along with its partnering agencies and stakeholders, implemented a suicide prevention campaign, including a World Suicide Light a Candle photo contest, a webinar of culture-based depression screening and evaluations in Chinese American immigrants, an online panel discussion about lived experiences, and an in-person event focused on senior blues in the Korean community. Many initiatives to strengthen local and civic engagements with elected officials took place, such as the instrumental passage of state legislation for Black Health Equity Week. We took a proactive approach by organizing presentation, meetings, and collaborations with key stakeholders, including prevention and early intervention providers, Representative Elias Reyes, and the Riverside County Sheriff's Department. Our unwavering goal was to advocate for the specific needs of the Middle Eastern and North African or MENA communities. Our efforts aim to raise awareness, forge stronger relationships, and ensure that the community's voices were heard and considered in all decision-making processes. Additionally, we participated in the 10-month cross-county collaboration with the San Bernardino County Department of Behavioral Health. The collaboration focused on assisting in the capacity building of Black-owned community-based organizations to fill gaps in the infrastructure to support these agencies in the continuum of sustainability. As the fiscal year 23-24 started, we collaborated with Workforce Education and Training to plan and develop a training program to increase understanding of working with people with disabilities. We teamed with the Lehman Center to design training for Spanish-speaking clinical staff to provide better and culturally infused services to Spanish-speaking clients, which we hope to implement this calendar year. Through continued collaboration between RUHS behavioral health staff, cultural competency, and the Center of Deafness Inland Empire, CODI, the Take My Hand Live peer chat now has a video chat capability to access live peer support services in ASL. It has hosted 11 chats since it became available in the second part of 2023. This pilot will continue to benefit the deaf community by allowing access to the support and resources needed when they are required. We met with the blind support services leaders and technicians to brainstorm solutions and learn how to adapt our products and services to people with low or no vision. We are now building a BSS wellness hub with a county kiosk, a charging station, brochure stand, and high-contrast materials accessible to screen readers. The efforts to support RUHS Mental Health Clinic in Blythe have continued throughout the year to improve the service quality. The community has seen positive improvements. Our liaisons have received positive reports from consumers regarding clinic staff, prompt appointments, and return phone calls and satisfaction with services. We have many other projects lined up for the upcoming months, including a pilot program integrating Korean dramas to facilitate mental health awareness and discussion among Asian Americans, and developing training for mental health professionals focused on spirituality's significance in person-centered mental health care. Stay tuned.
Some additional highlights from Work Plan 1 include community outreach events, like May is Mental Health Month, which have returned to in-person events and have expanded to include one event in each of our 3 service regions, Western, Mid-County, and Desert. Outreach events offer behavioral health awareness and education in a festival-like environment to normalize community dialogue around behavioral health needs and help seeking that is too often silent due to stigma. The Palm Desert event featured the annual Desert Art Show, which displayed nearly 500 art pieces submitted by behavioral health consumers and were available for purchase. The Mid-County event was held in Menifee, in partnership with the City of Menifee, with close to 80 vendors and featuring DJ Jesse Duran from Cola 99.9. The Western Region event at Fairmount Park featured a wellness corner with author Dr. Nishiro Coyote, who signed free wellness journals to those in attendance. PEI administration continued to offer trainings virtually and in person available to the general community focused on mental health awareness, self-care and wellness, trauma and resiliency, and suicide prevention. Additionally, in-person suicide prevention trainings were offered throughout the fiscal year. Trainings are free and available every month, and in total for fiscal year 22-23, 1,613 participants attended the 87 trainings that were offered. PEI, in partnership with the Suicide Prevention Coalition, will be offering short-term grief counseling for survivors of suicide loss at no cost to residents of Riverside County. This pilot project will offer 6 to 8 free sessions to suicide loss survivors through community-based clinicians who will be trained in a specific approach to support suicide bereavement. Applications are being accepted on an ongoing basis until the county determines it has obtained a sufficient number of providers to adequately address the needs of the county, issues a new procurement for this program, or if funding is no longer available. You can find the application at www.rivcospc.org. Later in this video, you will hear from Leah Newell, the lead staff person for the MHSA Innovation Component. Innovation plans are time-limited and allow the department to try new approaches that improve access or outcomes to care. The Tech Suite Innovations project, known as Help at Hand, has come to an end. Help at Hand included several projects designed to increase awareness of mental health and seeking help. These innovative approaches proved successful, and now, at the innovation project's end, several of these approaches have been integrated into the PEI plan. The projects that are moving forward to be included in the PEI plan are Man Therapy. Men are less likely to acknowledge their behavioral health and are more likely to experience consequences from untreated mental health needs. Man Therapy is a web-based campaign focused on reaching men with humor, normalizing men's mental health needs, and engaging men to think differently about their mental health. La Clave. La Clave means the key in Spanish, and this education campaign uses Latin cultural references to educate on the symptoms of schizophrenia spectrum disorders. These symptoms are commonly misunderstood, and helping the community recognize them is key to helping families get help for a loved one as soon as possible. The earlier the treatment, the better the prognosis. Take My Hand Peer Chat. Take My Hand is a peer-to-peer live chat interface operated by Medi-Cal certified peer support specialists. These trained peer chat operators support people ages 16 and over seeking non-crisis emotional support. Next, PEI Work Plan 4, which focuses on transition age youth, or TAY, providing outreach, stigma reduction, and suicide prevention activities for youth at highest risk of self-harm. This includes targeted outreach for LGBTQ TAY, TAY in or transitioning out of the foster care system, runaway TAY, and TAY transitioning into college. A highlight from Work Plan 4 is the Directing Change statewide program and film contest. This contest challenges youth to create a mental health-related public service announcement in several different categories. Riverside County Eleanor Roosevelt High School won first place for the Mental Health Matters category. The Riverside County local screening and recognition ceremony was held on May 4, 2023 at the Fox Theater, with approximately 350 students, advisors, families, and other community members in attendance. If you have questions or want more information about prevention and early intervention, please email us at pei@ruhealth.org. Thank you.
Thank you, Diana. Hello, my name is Leah Newell. I'm the MISA Innovation Lead. The innovation component of the Mental Health Services Act is designed to advance knowledge in the field of public behavioral health. These are time-limited research projects that require an additional approval process to access funds from the state. Our most recent innovation project, Help at Hand, which concluded in February 2024, was a 5-year plan designed to determine how technology fits within the behavioral health system. Help at Hand was a resounding success that taught us a lot about utilizing technology to reach our consumers. Many of the successful components have now been incorporated into the standard Riverside County behavioral health offerings. Help at Hand highlights over the final year of the project include the following. 87 kiosks have been installed in waiting areas throughout Riverside County and serve as points of service navigation and education. Collaborating closely with Rivco One, a countywide initiative for integrated service delivery, a special kiosk landing webpage is being utilized in 2 kiosks in the Harupa Healthcare Clinic. The specifically designed kiosk landing page provides links with access to programs and services, Epic MyChart, other departments and programs, and appointment check-ins for medical patients. The Take My Hand live peer chat, open and free to the Riverside County public, age 16 or older, provides peer-to-peer live chat interface using real-time conversations for people seeking non-crisis emotional support. The online chat can be accessed at a kiosk or directly online at takemyhand.co or tomamimano.co for Spanish speakers via an electronic device or smartphone via Take My Hand iPhone and Android app. The site hosts an ASL video in the terms of services for Take My Hand, in addition to the pilot offering live emotional video chat support to the deaf community via 2 deaf peer chat operators. 1,758 Take My Hand chats were conducted in 2023. Help at Hand also offered the Deaf and Hard of Hearing Needs Assessment Survey. Developed to gather information on improving mental health services for deaf, hard of hearing, and late deafened communities, the 27-question survey contained 81 ASL videos. Feedback from our focus groups and stakeholders was instrumental in incorporating the corresponding ASL videos for each of the survey questions. The survey also included an ASL County Resources video that includes the Take My Hand Live peer chat resource, as well as the local CARES line, urgent care, mental health facilities, and crisis lines. As of the end of the project, 2023, 7,346 surveys were completed. App for Independence, or A4I, an additional mobile app, is used to support the recovery process for individuals living with schizophrenia or psychosis. It includes tools that track treatment, progress, provide medication reminders, and help the user discern between auditory hallucinations and environmental sounds. Riverside County's pilot team is the first in the United States to utilize this emerging healthcare technology to create an umbrella of caregiving that involves all parties involved in the treatment. The technology is used in conjunction with other forms of traditional treatment, such as therapy or medications. Clients and caregivers collaborate and are kept in sync with updated information. 102 consumers participated in utilizing the A4I app. 12 clinic sites and 50 staff members also participated in the pilot. 2023 also saw expanded use of the Recovery Record app, featuring check-ins, CBT self-monitoring, DBT and ACT skills, outcome tracking, meal monitoring, clinical goal review, and motivation enhancement, assisting with eating disorder management. To date, 26 consumers and 58 staff members have connected to the Recovery Record app and clinical dashboard toward the goal of improving outcomes and enhancing support services for our eating disorder consumers. 23 members actively utilized Recovery Record with a participating provider, with the consumers sustaining a high level of engagement, collectively logging 5,276 CBT self-monitoring entries, or an average of 203 per consumer. Men are traditionally difficult to reach regarding behavioral health care, and as a result, are more likely to experience the consequences of untreated behavioral health challenges. Man Therapy is a mental health engagement campaign geared specifically for men, providing serious behavioral health information in a lighthearted manner. Man Therapy encourages site visitors to take a head inspection, a free, anonymous, scientifically validated online self-assessment. Man Therapy has been well received in the Riverside community, with 9,534 completed head inspections this year. Moving on to the Whole Person Health Score, providing Riverside University Health System patients and their care team an overall health assessment that is accessible and easy to understand, with the ultimate goal of encouraging individuals to take an interest in improving their overall health by looking at 6 domains of health: physical health, emotional health, resource utilization, socioeconomics, ownership, and nutrition and lifestyle. The Whole Person Health Score assessment tool was digitized and distributed to consumers via text and email. To date, over 12,000 invites have been sent via email to complete the Whole Person Health Score, and from those invites, 1,563 Whole Person Health Score assessments were completed. The majority, 766, from behavioral health. The clave, or the key in English, was created to help individuals and their families recognize the symptoms of serious mental illness and obtain treatment as early as possible. Targeting Spanish-speaking communities, La Clave serves as a guide to the symptoms of serious mental illness. 5 La Clave facilitator trainings were completed for RUHS staff and members of community organizations, including Visión y Compromiso, JFK Foundation Organization, Affordable Counseling Services, NAMI Temecula, Asian Pacific Counseling and Treatment Center, Olive Crest, and Peace for Chaos. La Clave content was also integrated within the Take My Hand mobile app and website, which went live in September 2023. Most recently, Univision en Español and NBC Palm Springs reached out to collaborate on promoting La Clave in the desert region, where there is a large percentage of Spanish-speaking residents. It is our hope that through La Clave, more Riverside County residents will know and recognize the symptoms and not dismiss them as ongoing life problems to better help people get prompt care for their loved ones. To learn more about our work with this innovation plan over the past year, visit our new website at helpathand.info. As Help at Hand ends, a new plan begins. Over the past year, we have been actively developing a new innovation project proposal, an eating disorder intensive outpatient and training program. Designed to address the challenges of treating an eating disorder, the project will create an eating disorder hub where we can examine how to best treat, train, and educate our Riverside County community. This $29 million project was approved by the state in February 2024. We are now awaiting approval by the Riverside County Board of Supervisors. Next up is Nisha to tell you about the workforce education and training component.
Thank you, Leah. My name is Nisha Elliott, and I am the manager over workforce education and training. The primary focus of the workforce education and training WET component is to assess and identify the continued workforce development needs for public behavioral health. The RUHS-BH WET program is committed to working towards the needs of our department employees because their development ultimately translates into quality care for the consumers of Riverside County. WET follows 5 work plans and their corresponding strategies and actions. Those work plans are as follows: workforce staffing support and training and technical assistance, career pathways, internship and residency, and financial incentives for workforce development. Today, I will share with you some highlights from each of the work plans that have an overall impact on our workforce as a whole. Over the past year, WET conducted, coordinated, or contracted for system-wide trainings that included, but were not limited to, department mandatory trainings like nonviolence crisis intervention or trainings required by California Board of Behavioral Services, such as law and ethics. WET also provided trainings on evidence-based practices like seeking safety, eye movement desensitization and reprocessing, trauma-focused cognitive behavioral therapy, and dialectical behavioral therapy, as well as specialized trainings for eating disorders. Over the last year, WET provided 99 total trainings, which offered a total of 407 continuing education units. WET also developed curriculums for the department's trainings. These curriculums have included trainings on human trafficking and mental health education. The Layman Center, our student training center and teaching center, also develops and conducts trainings across the department. These trainings include the SQUARE model on treatment and documentation conceptualization, and solution-focused therapy, a short-term, goal-focused, evidence-based practice. However, treatment models and intervention strategies are nothing without staff to provide the training. Therefore, outreach on public behavioral health careers is very important. Our outreach coordinator is consistently practicing and participating in events that educate the community and inspire students about diverse professions in our department, and the academic and experiential pathways to qualify for behavioral health job classifications. This past year, WET connected with approximately 1,316 students and included a public behavioral health career outreach event called Get Psyched. Get Psyched is a collaboration between RUHS-BH, WET, Vista Del Lago High School and Moreno Valley College, MVC, that aims to build a pipeline between MVC's human services, social work, and counseling programs to the RUHS-BH workforce. More than 100 students from several local high schools, community colleges, and community members were provided information about careers in behavioral health. Through this event, many people were educated. WET Staff Development Officer over Education is also invested in outreach, as it helps with the promoting of our internship and residency programs. The WET internship programs are super important and continue to be one of the most competitive behavioral health internship programs in the Inland Empire. In this past year, the Graduate Internship Field and Traineeship, or GIFT program, coordinated internships for 37 master's and bachelor's level students throughout the department. The county oversees this through the WET program. Over 51% of those students were bilingual, 46% spoke the threshold language of Spanish, and many have lived experience as consumers or family members too. These graduating interns become a prime candidate pool for a new department therapist. Nearly every student who applied for a department position was hired last year. In collaboration with Central County Human Resources, WET developed a Masters of Social Work county cohort that especially targets the need to recruit more clinicians, specifically in our desert area. Current department employees and the employees of our contractors are eligible to receive discounted tuition at UMass Global, as well as special supports just for this cohort. Quality development does not stop upon graduate school graduation. Developing clinicians is important to WET, and our training plan for the department includes supports at all levels for clinicians and clinician advancement, like student support, journey level, professionally licensed support, and support for clinical supervisors. The Clinical Licensure Advancement and Support, or CLASS program, plays an important role of supporting beginning clinicians. CLASS offers a variety of learning modalities to address developing clinicians, conceptualization, and intervention, preparing them for licensing exams and managing lives as public behavioral health professionals. The number of CLASS participants continues to grow, with an increase from 20 to 29 applicants. This past year, CLASS supported 16 clinicians, that's right, 16, to pass their licensure exams and promote into clinical therapist 2 positions. Most recently, WET received approval to centralize support for clinical supervisors compliance department-wide. It also helps CT1s. This will help WET assess the number of clinical supervisors identified where there's a greater need to develop more and ensure compliance with state regulations. Lastly, WET guides our department's employees on financial incentives, including textbook and tuition reimbursement, the 2020 program, and various loan assumption programs. Last year, 30 staff were approved for the WET loan repayment program, which equates to $300,000 in loan repayments in exchange for a commitment to remain employed by our service system. Next up, I return you to David to tell us about the last MISA component, Capital, Facilities, and Technology. Thank you.
Thank you, Nisha. The final component is Capital, Facilities, and Technology, or CFTN for short. This component funds the new buildings or information technology to support the infrastructure of service delivery. Current CFTN projects include the renovation of the 25-bed permanent supportive housing property for homeless consumers in Riverside called The Place. The Place has 24/7 on-site supportive services for homeless consumers who experience serious mental illness and originally opened in 2007. The renovation will allow for much-needed building upgrades, increased bed capacity from 25 shared room beds to 33 single-room beds, and increase the size of common living areas and group treatment areas. The renovation is scheduled to complete in December of this year. The Mead Valley Wellness Village is a full-service behavioral health campus that provides a safe, monitored, and therapeutic community and living space while simultaneously delivering high-quality, person-first treatment for behavioral health. Set to commence construction this year in 2024, the Mead Valley Wellness Village offers a variety of services, from treatment for mental health and substance use challenges to supportive housing and outpatient care for people of all ages. The village also will provide dental care, mammograms, access to a pharmacy, and employment support. This approach offers comprehensive care under one roof, simplifying the progression for residents to access the assistance and support they need for their health, well-being, successful reintegration into the community. Construction is anticipated to open in late 2026. Another development is a new augmented board and care in the city of Riverside. Renovation has begun on an augmented adult residential facility on Franklin Avenue. When complete, this adult residential facility will provide approximately 81 beds with integrated on-site full-service partnership, or FSP services. This facility is expected to open in December of this year in 2024. This facility would provide a level of service comparable to the department's existing adult residential care facility located in Palm Springs called Roy's Desert Springs and Windy Springs Wellness Center combination. And that concludes our presentation. Thank you for participating in this year's Riverside County Mental Health Services Act annual update. Don't forget to click on the link for more information, or to complete an online feedback form about the plan, or to use the MHSA Plan Feedback telephone line if you prefer to leave recorded feedback instead. Wishing you the best, and be well.